The professional journey the participants went through. There were the initial feelings of professional loss, feeling of otherness, rediscovering nursing, and it all works out in the end. However, for the purpose of this presentation, the third theme, rediscovering nursing, which encompasses 4 sub-themes, namely preparedness to work, working with patients, working with doctors, and let's talk about professionalism, will be discussed. In relation to their preparedness to work in the WA hospital setting, the participants were able to find similarities in the practice of nursing. It is the same. At the end of the day, all we do is we look after sick people. That's the purpose, and the goal is the same. However, they also found differences. The work is not much the nursing skills here. The emphasis is on communication skills, and we have to do everything. They realized that they had broader clinical skills than their WA colleagues. However, the holistic approach to patient care and the high level of communication skills left them overwhelmed. Furthermore, they were not all familiar with the other health services. Our society doesn't have the resources to help people, so it's not part of the care. You don't pay attention to patients' psychosocial issues. Here, in Western Australia, it's a large part of our duty. The limited and often unfamiliarity with the extended and specialized highlight health services available to patients left many participants confused. With working with patients, the participants felt that the nurses' approach to patient care and the patients themselves were different to what they were used to. The patient-centered approach surprised and pleased them. I only look after 4 patients instead of 40. I love it at the first sight. The ratio nurse patients was welcome. The way the Western Australian patients expressed themselves surprised many participants. You can see what they want. When they say no, it means no. They show their anger and many different emotions. They don't hide. They felt that the patient-centered approach to nursing care encouraged patients to communicate, something that they were not all familiar with. However, despite the less formal interaction between nurses and doctors, some participants felt that doctors dominated the health structures. You, as a nurse, don't make decisions without doctor's consent. In her country, Lucy initiated a plan of action before contacting the doctor. Rewards, annual leave and sick leave entitlement. However, for most of the participants, the working conditions were better than in their home country. However, at a macro level, in working with patients, the sense of appreciation differed. Here, we look after the patient holistic care, eating, drinking, showering, hygiene, and mainly because of that, we don't get much respect. In my country, a nurse is regarded much more as a profession. We are more a professional group.
Understood, interpreted to meet needs in health, illness and disease. And I think really I'm thinking about 3 different types of main research. The large operational research, which is targeted at projects to meet global and local health needs. The scientific type of research, the basic clinical epidemiological research, which is critical nationally, internationally and locally. But of course, all of us, I think, recognise that the importance of the human experience cannot be discounted, that international qualitative research is so essential to holistically understanding and interpreting the realities of people's lives and experiences within and between cultures. So internationalising requires research and development requires international efforts from many sectors, including health professions, as I've said before. I think it would be a wonderful world if internationally we can lobby together for funding for health, for funding for research and education initiatives. And there are many bodies that are trying to do this at global level. But I think we can do more of it, because I think we'll become very powerful if we can join in international activities together. And networking and mentoring across countries is so important, as people at this conference have told us. So some of our challenges that remain for qualitative researchers is how do we design, implement and fund and evaluate qualitative research? How do we ensure qualitative research not only understands the human experience but makes a real impact to help people lead healthier lives and reduce the burden of disease? How do we go about convincing others that qualitative research makes a difference and that it is a valid form of evidence? For many of us, those challenges still remain. And we've got to try to stop, I think, researching the same topics and remember the so what principle when we are researching. And I want to encourage all of you that it's important that early research of early publishing of your ideas, opinions and practices is so important. Publishing your research and getting it to international and national and local journals is important. Don't put it off. Many international journals won't accept your research if it's more than 5 years old. But ideas and innovations and solutions change rapidly, so we need to get our good qualitative research and other forms of research into print as quickly as possible. It's a challenge for all of us. We all might just go home and find that the desk or our homes are full of work that we haven't touched for a few days, and it's easy to put this conference out of our minds and say, yes, I'll get around to publishing. But it's just too important to forget about, too important to put off. So I hope all of you will think about this. And where you need help, don't be scared to ask other people to help mentor you through the process of writing those papers, whether they're in your own language or in another language. And I just hope and wish that we weren't too worried about impact factors in journals these days, because we know that high impact factors necessarily don't have an effect. The access to those high impact factor journals is sometimes limited on the ground floor to the clinicians, the practitioners who need to access evidence for practice. They often can't get access, or they don't understand it. So publishing internationally is terrific, but don't forget the local situation. Don't forget your local languages. So here we are at this conference, nearly at its end, situating and stipulating qualitative research in nursing and healthcare. I really think that the organisers can be very, very proud that they've actually produced a wonderful conference. I've certainly enjoyed it. I know other people have. And I think it's been a very important conference, so important that the Prime Minister of Thailand takes a moment to write a message of greeting, and that many important health ministers have come to this conference. The local governors, the local public health sector, have recognised the importance of it and supported it. And it should not be too amazing to us that the Thais have managed to do this, even in the north of Thailand, because I think when you set out to achieve something, you do it, and you do it very well. And even though it might be your first international conference, behind the scenes many of you would have worried about how difficult it was. Many of you probably didn't get any sleep, worrying about what you had to do next. Many of you might have lost several kilograms in weight. But behind the scenes is one thing, but what happens to the front of the house is different. I think most of us will recognise that it's been a wonderful cultural, social and educative Thai and international experience. It's been colourful, exotic, friendly, welcoming, well-rounded, and we've had lots of great opportunities to network, to share and to learn. Right from the moment when I stepped off the plane, I could feel the energy of this conference. And we've had, I think, right from the days of the early workshops, it seems so long ago, but it's actually the day before yesterday. The work with the workshops, the wonderful foods, the dancing, our colourful and exotic dinner last night, and for many of you that was your first experience of Thai culture, and I think one of the things that I've learned is that if you are Thai, you must know how to dance and you must know how to sing. Yes, even the community, the Minister for Community Health from Bangkok gets up on the stage and sings. So you have to sing and you have to learn how to dance. And I think wherever I go and wherever I come across Thai students of nursing, there they are with their wonderful skills, like the ones in this photograph, who came to our forum in Japan. So thank you to all of the conference organisers and sponsors and co-sponsors, and to everyone who was involved in helping us to join together here in Chiang Rai. You've done a fabulous job. And I hope that your director won't mind me singling you out, Dr. Talwarn, but I would like you to come to the stage.